Welcome, and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. On the program today, we're going to attempt to share with our listeners, especially you men out there, a way that you can perhaps get away from having to use things such as Viagra if you're suffering from what is known as erectile dysfunction. On the program today, we're going to be talking about a drug-free alternative to using these such medications by using something known as a GAINSWave therapy, which is a scientifically proven pulse wave technology that can help to treat erectile dysfunction by encouraging blood flow and stimulation. On the program today, we're being joined by Dr. Catherine Retzler, who founded Hormone Synergy Clinic, which is located in Portland, Oregon. She likes to help people through natural remedies to be able to achieve vibrant health and ideal brain function as well as longevity. I'd like to welcome to the Beyond 50 radio program today our guest, Dr. Catherine Retzler. Dr. Retzler, thank you for being on the program today.
Thanks for having me, Daniel.
Now,
it's been a long time since we've talked.
It's been quite a long time, and you're out there with these new GAINSWave things. What's going on here?
Well, I've been practicing now for about 16 years doing age management and functional medicine. And, the longer I'm in practice, the more I want to treat the cause. And I was writing too many prescriptions for the phosphodiesterase inhibitor medications. Those are things like Viagra and Cialis and Levitra. And I just started thinking through, why do men end up with erectile dysfunction, and what are we missing, and is there a treatment that, wouldn't involve constantly contributing to the bottom line of those drug companies, and also, getting some results for the men where they wouldn't have to actually take a pill before they want to have sexual activity. So I found Dr. Gaines, who's an anesthesiologist by training in Florida, and he did some research on a treatment that's been in Europe for about 15 years, which uses pulse wave technology, so similar to what's used to break up kidney stones, but in a lower concentration, and read the data on it and brought it to this country and started training physicians. So that's what's behind that device, and also my interest in, treating the cause and getting some results for men that are non-drug options.
Now, since you've been implementing this treatment here, what would you say the youngest case has been that you've worked with?
Oh, that's a good question, because I just started doing the treatment. So I would have to say, I'm not a good person to ask because I've only been doing it for a couple of months. But, 52% of men over the age of 40 have erectile dysfunction. Most of them are unreported. And this device is really meant for men who have erectile dysfunction that's due to, vascular causes, so blood vessel issues, not necessarily pathological causes. So I would say, the youngest guy who's a good candidate is probably 40. Too much younger than that, there may be something else going on. For example, depression or stress, actually porn-induced erectile dysfunction, which is unfortunately becoming an epidemic against younger men. So this is really a treatment, I think, mostly for older men and for whom it's not a psychological issue, although, if you have erectile dysfunction and it's been going on long enough, then there's the performance anxiety that comes secondary to that, and that can contribute to the problem too. But I would say the youngest guys that I would be willing to treat would be in their 40s, and I would assume that that's true at Dr. Gaines' clinic, who has a lot more experience with the therapy than I do.
Now, it's pretty interesting that this does occur. Do you find that it's usually later on in a man's life? Is it hormonal, or, what's really going on here? There seems to be a lot of different schools of thought here.
You mean the causes of erectile dysfunction,
right.
Why it's happening?
Mm-hmm.
Well, there's actually quite a few causes, and a lot of them overlap. As we age, we can end up with microplaque, so, atherosclerosis or plaque in the arteries, and that's actually a contributing cause, and I would say it's probably the most contributing cause to erectile dysfunction in aging men, is that their blood vessels start to change and they don't work as well. So, in my practice, I make a really big deal about treating everything because I want to make sure if a man has erectile dysfunction that's secondary to vascular disease, that we're treating the vascular disease that's also occurring in the brain and the blood vessels that feed the heart, right? Because that's good medicine. But that's a pretty common cause, and this treatment specifically I like for that cause because what it's doing is breaking up the microplaque that's in the blood vessels feeding the penis It's increasing something called nitric oxide, which dilates the blood vessels, including the blood vessels of the penis. And then over time, it's actually stimulating neovascularization, which means new blood vessel growth around the areas that may be blocked, so that that it can actually treat the cause. But so vascular issues are probably the most common cause of erectile dysfunction. Other contributing factors: diabetes, which blood sugar contributes to vascular disease, high blood sugar. Low testosterone, so I screen all my guys for testosterone insufficiency and make sure that their testosterone is optimal, because without optimal testosterone, you can't make nitric oxide in the penis, and so you're not going to have good erections. Plus, you won't have the desire. So that's a really important preceding event to an erection. Smoking, which damages the blood vessels. Neurological diseases like MS, which can damage the nerve tissue that's playing a role in erectile function. Like I mentioned, excessive use of pornography can be a contributing cause to erectile dysfunction. Stress and performance anxiety. Quite a few medications. I would say the most common medications that can affect erections are going to be the SSRIs, things like Prozac and Zoloft, and then beta blockers, which a lot of men are on as they age, like metoprolol and carvedilol, that can affect erections. Sometimes drugs that are used for sleep or anxiety, like Ambien or Xanax, sometimes that can affect erections. Diuretics, I don't see diuretics as often, but that can affect erections. So there's so many different possible causes of ED. Really important to, of course, screen for those and make sure the cause is being treated in those cases. But then the GAINSWave is just, like I said, it's the device that can treat the vascular component for the most part.
Now, what kind of, clinical research is behind this? How long has it been kind of in play here?
Well, that's a good question. If your listeners go to Dr. Gaines's website, he's done a really good job of compiling the literature and making it easy to understand. And that's GAINSWave.com. I think it's /research, but I'm sure they'll find it if they go to the homepage. But there's been research on this specific technology in Europe for about 15 years. It's rather new to this country, but there is research going on now, and there has been research in humans showing it's effective. It's estimated to be between 50 and 80% effective in terms of either decreasing the need for the medications, or some men who are able to get off the medications entirely, or the medications working better. So, some of my favorite guys to offer the treatment to are men who are desperate. Oops, are you there? Because I'm hearing a beep on my end.
Pardon me?
Oops, are you there? I was
yes,
hearing a funny beep on the phone. Some men who have treated their testosterone, they're trying to improve their health, they're on Viagra or Cialis, and it's not working. And these are some of my favorite men to offer this treatment for, and part of why I went to get the training from Dr. Gaines is because we haven't had anything to offer them besides, using trimix injections in the penis itself, or worse, surgery or something. We haven't had anything to offer them. And so this treatment has been shown to be effective for ED for men for whom we don't really have anything else to offer, which is why it was exciting for me to find it and read the research on it and know that maybe this will help.
Now, I understand this is something that pretty much any man is able to take part in?
You mean, are there any contraindications to the therapy, or could it be harmful in any way?
Sure.
Yeah, there's really there hasn't been any adverse outcomes to this therapy. Now, we give men a numbing cream, and the numbing cream, prevents them from feeling anything during the treatment. It's low-intensity shockwave therapy, so it's, some people hear that term shockwave therapy and they get nervous, and probably a better term is acoustic wave therapy, because it is acoustic waves that are being used, but it's low intensity. So the high intensity is what's been used to break up kidney stones and gallstones. Medium intensity is what's used to heal things like tendinitis or bursitis. So this is low intensity. And, I was talking with Dr. Gaines. We were comparing notes about our numbing creams, and he said, when he uses it on some of his patients, he doesn't use anything. and he's an anesthesiologist, he just knows that, if you start out at a low frequency, eventually the men don't even feel anything when they get the treatment, and you can increase the intensity of it. I do use the numbing cream, but maybe we don't even need to be using it. I don't know. I haven't played with that yet. But there's no bruising or no, like when people have gotten their kidney stones treated. There's none of that. It just may feel a little bit prickly while the treatment's being done, and there's no adverse reactions in terms of long term. So it's really one of those treatments that, as somebody who's trained in first do no harm and takes that very seriously, I like offering it because I know there's no downside, except for some men it may not be effective. But, there's no downside in terms of harm.
Now, with the GAINSWave, is it only available for men who are probably having erectile dysfunction, or what do you say to that?
You mean, could it also help with performance instead of just ED? Yeah, that's actually interesting. So it can help with performance. In some men, they notice, their penis size can increase or their erectile hardness improves. As men get older, one of the things they'll notice is that they can't have alcohol and expect to sustain an erection as easily as when they were younger. And that's one area that you see improvement, an immediate improvement. In other words, you get GAINSWave treatment, and then that evening you'll notice the nitric oxide increases, so you can get and maintain an erection even when you're using alcohol easier or more effectively. So, some men who don't clinically have erectile dysfunction, meaning we give them the questionnaire, they don't meet the definition, but they want improvement in terms of their performance. They want to be able to have more than one orgasm in an evening, or they want to have more sensitivity. So the sensation of the penis will change over time with the treatment, so it may feel more pleasurable to them. So the technology can be used for that reason too.
Now, it's interesting to have this here, and you wonder, okay, how soon does a person, experience the benefits of using GAINSWave?
Well, the average treatment is, 6 sessions. Some men will do up to 12 sessions. We do them, 2 to 3 times a week, so it gives the body a break in between. But some men will notice some effect the first night, like I said, and these tend to be men who don't have severe erectile dysfunction. They just want a performance enhancement, or maybe they have trouble maintaining an erection, so a little bit of mild dysfunction. And for some men, they're early responders. They'll notice a change within a couple of treatments. They're, like I said, if they're using their phosphodiesterase inhibitors like Viagra or Cialis, they'll notice them working better. Or I had one guy say, he didn't need to use it for once, which was a surprise to him. And then sometimes there's the late responders. So over time, the therapy is improving the regeneration of blood vessels around plaque that are feeding the penis, and so that takes time. So, usually we say give it up to 4 weeks after the treatment, and when they've done the research on the treatment is usually between 5 and 12 weeks, and then they monitor the guys for up to 2 years to see what happens over the 2-year period. So it can be effective for up to 2 years. I'm not familiar if anybody's done research longer than 2 years to see if the effectiveness is maintained. I know that at Dr. Gaines' clinic, they usually, they've been keeping data, which is part of the reason I wanted to do my training with him, because he's keeping questionnaires on all the men, and everyone he trains agrees to contribute to the database, so we can follow this therapy and see how long it lasts. And I know that he's been mentioning he thinks that if you do it once a month after the initial therapy as sort of a maintenance, it will sustain the effect a lot better.
Now, just recently I was watching a documentary that had a lot to do with talking about getting away from animal protein and more of a plant-based diet, and it seemed that these older gentlemen were talking about how the flagpole all of a sudden was being raised. So let's take a look at diet, because that seems to also kind of come into play too, especially as people get older. And I found that kind of intriguing that they would say, as we pull the animal fat back, you were seeing, or protein, just eliminating that mostly from the diet, reversal of heart disease, just a lot of these things reversing as you induced more of a plant-based diet, that these things started coming back and working again like they're supposed to. In your experience, you're a naturopathic doctor. I mean, you're looking for ways that you naturally go after the root cause. What are your thoughts on something like that?
I'm so glad you asked that question. Because a lot of times we focus on, one thing like erectile dysfunction without thinking about the big picture. And what you're asking is a big picture question. I mean, there's a hierarchy of therapy, right? Diet and exercise are paramount. And we can think about the mechanisms by which, improved diet is happening. And I agree with you. I think people need to be eating a plant-based diet. And by plants, I mean fruits and vegetables and, legumes, nuts, seeds, things that grow, using meat as a condiment, which is what I tell most of my patients, especially those with vascular disease and especially those who are ApoE4, so genetically should be eating more of a plant-based diet. I do have no problem with some people who need more animal products in their diet. I just really stress that they're organic and free range and that, they're keeping fat in mind. There's a huge movement now that everybody needs to be on a ketogenic diet, and we could talk about that for an hour. But what I recommend is a phytonutrient-rich, which is what you're talking about with plants, diet, because all of those phytonutrients, all of those flavonoids, are extremely beneficial to the blood vessels. And one thing that people don't think about, and I'd love to get this message across, is that vascular disease happens in real time. So people think, it's happening down the road, but this is not the case. Every single time you eat, every single time you have a thought, every single time you exercise or not, you are affecting the health of the endothelium, that lining of all the blood vessels, and you are affecting whether or not you're forming plaque or reversing plaque, forming clots, reversing that tendency. With every meal, with every thought, because stress hormones disrupt endothelial function and contribute to plaque formation. Every time you exercise, there have been a lot of studies done on actually measuring endothelial function, having somebody go run 2 miles, come back, and it improves in real time. And one of my favorite studies that I show patients is the McDonald's study, where they gave patients sausage egg McMuffins and hash browns. And they measured the endothelial function, and that's the single layer of cells that lines all blood vessels that's critical in terms of preventing plaque formation and preventing plaque from rupturing and clots. So they gave them this horrible meal, which I find hard to pass an IRB, but unfortunately it did. So they gave them this meal. They measured their endothelial function, and for 4 hours, that single meal caused endothelial dysfunction. So the next day they gave them the same meal with antioxidants, and it blunted the effect. Now, the take-home was, when you take antioxidants, take it with a meal. My take-home is, don't eat that food in the first place, because in real time, that trans fat, saturated fat, high salt bolus that's going into the GI tract, causing transient leaky gut, endotoxemia going through the bloodstream, is affecting the blood vessels at that moment. So if you think about, I want to have a healthy sex life and erections, you've got to think about it every time you eat a meal, right?
That makes sense,
So it happens in real time. Yeah, and if you eat the phytonutrients and the high antioxidant-rich food, you're doing the opposite. You're affecting the blood vessels in a positive way in real time. So thanks for bringing that up.
Well, I had to, because I noticed just doing one simple thing like making the green fruit smoothies, that's usually breakfast, and, you just feel good after something like that. And I remember as you were talking about, the Egg McMuffin and the hash browns, some years ago when I went out to breakfast, a typical Sunday morning, and I remember after eating realizing when I was done, the next thing I wanted to do was go home and take a nap. And I thought to myself, well, that isn't what breakfast is supposed to do for you, so I don't eat like that too much anymore. I mean, it's rare that I go out and eat like that. And so to talk about the correlation, of course, diet in a situation like this is to realize for a person to say to themselves, when they're done eating a meal, how do you feel after that? What is your next thing you want to go do? And if it's to go to bed, then maybe it's time to switch up a little bit.
That's great advice. Or if you feel like your brain's foggy, you don't feel sharp, that's great advice. I like that.
Now, I was curious. Now, you were saying that, the effects can last as long as up to 2, maybe 3 years, but what if people start making other changes where it might even cause us, kind of call it breaking the dam, if you will, and just keeping that water flowing without having to go back for treatment? Is that something that's possible?
Absolutely. Yeah, I think that, the GAINSWave device is just a tool, but, diet and exercise are paramount in stress management. So eating that phytonutrient-rich diet and minimizing sugar, by the way, and all other forms of sugar like refined carbohydrates, bread, pasta, pastry, cereal, etc., eating a phytonutrient-rich meal or diet all the time, recognizing every meal counts, prioritizing exercise, and none of this I don't have time business, like it's a priority, prioritizing sleep, right, getting adequate sleep, all of those things are fundamental. So the GAINSWave is just a tool, and of course if you're doing the fundamentals, and then it's going to be more effective, and making sure your testosterone is optimal and all those contributing factors too.
Now, earlier in the program, you were also mentioning one of the contributors could be the use of alcohol. Tell us about why that is.
Well, that's a good question. You mean mechanistically what alcohol is doing?
Yeah.
Well, it's certainly causing a transient reduction in nitric oxide production in the penis. So, with too much alcohol, acutely you're getting an effect. In alcoholics, you're going to have all the complications of heavy alcohol use in terms of, nutrient depletion, B vitamin depletion, fatty liver development, blood sugar dysregulation. So I think, there might be two things going on. One is an acute transient effect. And of course, that's also affecting the brain. We have to bring that into consideration that, really erectile function happens in the brain originally. You've got to have the desire. You've got to have the right neurotransmitters. If you don't have enough dopamine, for example, you won't have a libido. So the reason that testosterone helps with libido is not because it's working on the penis as much as it's working on the brain. It's increasing dopamine release, and especially if you have enough dopamine to begin with. So that's a brain phenomenon. Libido is a brain phenomenon, and if you drink a lot of alcohol, you eventually deplete dopamine, and so you don't end up with much of a libido to begin with. So, that's actually an important thing to talk about when we talk about erectile function is what's happening in the brain and what's happening with the autonomic nervous system, because if you're in sympathetic dominance, the fight or flight aspect of your nervous system, instead of autonomic dominance, which is rest and digest and procreate, if you've got that switch flipped so that you're always running away from the tiger, you're not going to have a libido, and your erectile function is not going to be effective because erections are actually a parasympathetic activity. So you have to be relaxed. This is all obvious, right?
Right.
You have to be relaxed. But if you're stressed and you're making a lot of stress hormone, your body is going to preferentially help you survive, and you're not going to have a libido, and from dopamine or from blood vessel effects.
It's interesting, the brain-penis connection. And then people say that that was some sort of a myth, I guess, but apparently it's very true physiologically speaking. Now,
yes,
how can someone find a doctor as they listen to this today and find out, where they can go and ask questions, get information, stuff like that?
Well, I think going to Dr. Gaines's website, I think he's done a really remarkable thing. I've been in practice a long time, and I train physicians in bioidentical hormones and pellets. And one thing I really appreciate in other physicians are those who are giving back. They're teaching. They find a therapy that's effective, and rather than just patenting it and trying to make as much money for themselves, they're actually sharing the information and empowering other doctors to treat more patients, and also collecting data. I really respect that more and more the longer I'm in practice, and this is what I think Rich has done. So his website has a lot of research, it has a lot of information, it has a place to find a doctor who's trained, and because they're doing the training, it was very well done, by the way, their training. they're able to replicate the effect because they're training the physicians in the same way, and it's the same device that's used, and it's the same protocol that's used. So his website is GAINSWave.com. So it's just spelled GAINSWAVE.com. And, there's FAQs on there and all that sort of thing, so somebody can easily look that up.
And then they could also find out more about your work and, of course, the diversity of what you actually help people with at hormonesynergy.com.
Yep, hormonesynergy.com. And my book is out of print, but we do have an ebook available, so we give that out to patients for free if they really want to learn more. So they can get on the website and ask to have a copy of that sent.
Well, that's excellent. Catherine, it's been good to talk with you again. I know it's been a long time, but there's a lot of times we put stuff out there to let people know, hey, this is available, and let's find natural ways to get back to having fun and being who we are again and being explorative and, just enjoying life as we should be doing. And it's been a pleasure to have you back here on the program again.
Thanks, Daniel. I appreciate you having me. Hope you're doing well.
Always. So we got two websites. GAINSWave.com is the first one. We're talking about the GAINSWave process, and then there's also HormoneSynergy.com as well. Dr. Catherine Erectile, thank you for being on the program today.
You're welcome. You have a great day.
You too. We want to thank you, the listeners out there, for tuning in. You can also discover more. Visit us at Beyond50Radio.com. That's the number 50. Sign up for our weekly e-newsletter and keep up to date with what's going on in the world of Beyond 50 as well as upcoming shows. I'm Daniel Davis. Thank you for tuning in. This is the Beyond 50 radio program. Remember, live your day past halfway.